Have you ever been blindsided by a medical bill, feeling like the price listed was just a suggestion, not a fixed amount? It is a common experience, and there is good news. Yes, you absolutely can negotiate a reduced cash price for medical bills, especially if you are uninsured or your insurance will not cover a particular service. Many healthcare providers offer significant discounts for patients who pay upfront or are willing to settle their bill directly, bypassing the complexities of insurance claims. This approach can save you a substantial amount of money. The fundamental reason this is possible is because healthcare pricing is often complex and variable. Hospitals and clinics typically have a chargemaster price, which is the highest rate, but they rarely expect anyone to pay that full amount. They negotiate different rates with various insurance companies. When you pay cash, you remove the administrative burden and collection risk for them, giving you leverage to ask for a lower, more realistic price. To successfully negotiate, start by requesting an itemized bill, not just a summary statement. This lets you see every charge. Then call the provider's billing department. Be polite but firm. Explain your situation, whether you are uninsured or facing high deductibles, and ask for their cash pay discount. Many facilities have standard discounts, sometimes as high as 20 to 30% just for asking. If they offer less, you can research what Medicare or Medicaid would typically pay for the same service in your area. Websites like healthcarebluebook.com or fairhealthconsumer.org can provide estimated fair prices. Use this information as a basis for your counteroffer. Suggest a payment plan if a lump sum is not feasible. Remember, their goal is to get paid, and your goal is to pay a fair price. Do not be afraid to escalate your request to a supervisor if the first person cannot help. Persistence is key. An insider tip is to mention that you are a self-pay patient even if you have insurance with a high deductible. Sometimes, this phrasing can open up a different set of discounted rates. Also, be aware of the surprise billing protection provided by the No Surprises Act, which helps protect you from unexpected out-of-network charges. While primarily for emergency care and certain non-emergency situations, understanding this act reinforces the idea that you are not solely at the mercy of listed prices. Always confirm that any agreed-upon reduced price is reflected in writing. Taking control of your medical bills by proactively negotiating can transform a stressful financial burden into a manageable expense. By understanding the pricing structure, knowing how to ask for discounts, and being prepared with information, you empower yourself to navigate the healthcare system more effectively. This not only saves you money but also provides a sense of peace and control over your personal finances.